I think it's about really opening the dialogue, being transparent and authentic to what you're saying. You know, what we've found within the cancer community is that people really want to share their story. They want to be out there, they want to tell people what they're feeling like, and they want to help that next person through their experience. So as long as the brand aligns with the values of the individuals, then I think that they can continue to participate and really, you know, form this like kind of partnership.
That's great. So we're going to stay on this topic of some of these benefits and these connections. And Kevin, I'm going to ask you to share a story that actually you shared with us a little bit earlier today, talking about the benefits and the risks for someone to participate in social communities. And I'm hoping you can share the story you shared with us today.
You know, from a physician standpoint, there's definitely risks and benefits with getting out there in social media. And what I counsel physicians about is understanding the rules of the playground. You need to understand what a doctor-patient relationship is. And if you enter a doctor-patient relationship on social media, then you have a duty to that patient in legal terms. And you have to be very careful about that. I actively engage patients from all over the world, but I do it in a way that's not patient-specific. I may give advice about a particular cancer and say, if you're interested in learning more, this institution is doing clinical trials in this particular area. But I think you have to be very careful about taking that risk of entering a doctor-patient relationship, because then you do have a duty to that patient. Very different than telemedicine. You're, by definition, interacting with a patient, creating a doctor-patient relationship, and have a responsibility and a duty to that patient. That's different than Twitter or discussions around that sort. Was that what you were looking for?
Yeah, that was exactly it. But Nate, I see you taking down some notes. Can I ask you to comment on that?
Sure. So I think as a physician on social media, there's obviously a number of different platforms that you can enter, whether you're facing other doctors or patients or just creating content for the world at large. But there's also a number of different roles you can assume. So not everybody has to be the creator. It's quite valuable to be the curator and take a slightly safer path. It's also okay to be a listener. And to put it in perspective, there's an exponential amount of literature out there in healthcare every single day. And it actually takes 17 years for medical knowledge to disseminate in this country. So with more to read every day, and the fact that once you finish your training, you're just going to get the occasional conference that's harder and harder to sponsor and get docs to come to, it depends on this kind of cohesive network of doctors with everybody sharing a different role, whether you're educating the patient or your fellow doctors or just curating and passing things along, to be able to make sure that this knowledge is being distributed in the right way. And as a brand, I think you should not only respect that, but make sure that you're applying the same level of focus. Doximity has over 50% of US doctors on the site, and we have 28 different items on each CV per doctor. That is an incredible ability to choose who you're going to engage with. If you decide to take the shotgun approach and try to engage with everybody, and we're only doing experiments with brands right now, we're not doing large approaches anyway, but if you took a shotgun approach, you would lose that audience. Whereas if you spent your efforts on focusing on the people that could really benefit from your information, you'll end up with a much happier outcome and engaged audience. On the provider side, it's a little different. There's certainly the providers saying, oh, I don't see the value in this social media because it hasn't solved their problem, but their fears actually fall into two other areas. The fear on the provider side is more either around HIPAA, or it's around being misunderstood. So the two of those, you often hear about HIPAA because physicians do have a spotlight on them, and when they do something wrong, they can get in trouble quickly. And that can take the effect of either someone saying something they shouldn't on a public social media forum or thinking they're anonymous. You're probably not anonymous, even if you think you are. And even if you are today, that might not be the case in the future. Or it happens because they're using software that helps them get their job done. So a lot of doctors text. They send regular SMS, non-encrypted messages, and a lot of doctors use things like Google Docs or Evernote. And they don't get in trouble. There's no Google Docs police. It's somebody goes and loses a USB stick, and then they have an audit, and then everybody gets in trouble, and a lot of heads roll, and things go bad. So it's our responsibility as software developers and other innovators in the room to make software as easy as Google Docs and Evernote and Twitter and Facebook and things like that if you want to get physicians to use your secure alternative. The other concern that they have is being misunderstood. You see this play out in review communities. Doctors look at themselves and they Google their name and they find out that somebody says, oh, the coffee in this guy's room was absolutely terrible. And, or it might actually be something about a procedure that they've done, but then you can't talk back because you've identified some sort of a patient-doctor relationship. And so they withdraw into their shell, or they try to change their name on Facebook. And really what they need to understand is that in those cases, actually, the best defense is a good offense. And by being able to have a strong web presence, say your own domain name, your Doximity account, we copy everything over to a US News profile so that you can control 2 out of your top 5 search results. That's going to be 85% of all patient clicks. And you can push the things that you don't want people to always see about you that aren't true down the page and be more understood.